Hello everyone, my name is Alduber Benitez. In this presentation I will be talking about fentanyl abuse as part of my psychiatric mental health nurse practitioner program of Herzing University. Fentanyl has emerged as one of the most dangerous substances in America's ongoing opioid epidemic. This synthetic opioid is 50 to 100 times more potent than morphine, making it both medically valuable and extremely dangerous when misused. Throughout this presentation, we will explore the history, prevalence, effects, and treatment approaches for fentanyl abuse. As future healthcare providers, understanding this crisis is essential for providing effective care to affected patients and communities. Fentanyl is a powerful synthetic opioid analgesic, similar to morphine but 50 to 100 times more potent. It is prescribed for severe pain management, typically after surgery or for chronic pain patients who are tolerant to other opioids. However, illicitly manufactured fentanyl has become a significant contributor to overdose deaths in the United States. This illicit fentanyl is often mixed with other drugs, such as heroin, cocaine, methamphetamine, and MDMA, sometimes without the user's knowledge, increasing the risk of fatal overdose. The high potency of fentanyl significantly elevates the risk of overdose, especially when individuals are unaware they are consuming it. Naloxone can reverse a fentanyl overdose if administered promptly, but multiple doses may be necessary due to its potency. Treatment for fentanyl addiction typically involves medications like methadone, buprenorphine, or naltrexone, combined with behavioral therapies. Fentanyl, a synthetic opioid analgesic, was first synthesized by Dr. Paul Janssen in 1959 and introduced into medical practice in the 1960s for pain management. Its high potency, 50 to 100 times stronger than morphine, made it effective for treating severe pain, particularly in cancer patients. The history of fentanyl abuse can be traced back to the mid-1970s when illicit use of pharmaceutical fentanyl and its analogs began emerging within the medical community. Since then, over 12 different clandestinely produced fentanyl analogs have been identified in U.S. drug trafficking. These substances are often mixed with or sold as heroin or oxycodone, leading to increased risks of overdose among users unaware of the drug's presence. The potency of fentanyl has significantly contributed to the rise in overdose deaths, marking it as a central factor in the ongoing opioid epidemic. In the 2010s, the United States experienced a surge in fentanyl-related overdoses, with deaths involving synthetic opioids, primarily fentanyl, increasing from 2,600 in 2011 to over 70,000 in 2021. This escalation is often referred to as the third wave of the opioid epidemic, characterized by the infiltration of illicitly manufactured fentanyl into the drug supply. The drug's high potency and the unpredictability of its presence in other substances have made it particularly lethal, contributing to a significant increase in overdose fatalities. The widespread availability and misuse of fentanyl have had profound impacts on public health, prompting efforts to address the crisis through policy changes, increased access to treatment, and harm reduction strategies. Despite these efforts, fentanyl continues to pose significant challenges due to its potency, ease of production, and the complexities of illicit drug markets. Prevalence and epidemiology in the U.S. According to the CDC, synthetic opioids, primarily fentanyl, were involved in over 70,000 overdose deaths in 2021. Fentanyl-related deaths have increased 23-fold from 2013 to 2021. The majority of fentanyl-related overdoses involve illicitly manufactured fentanyl, often mixed with heroin or cocaine. Risk factors and vulnerable populations. Individuals with opioid use disorder, OUD. Those with a history of substance abuse. People experiencing chronic pain. Individuals with mental health disorders, such as depression or PTSD. People who inject drugs. Youth and young adults experimenting with substances. Those with limited access to healthcare or economic instability. Short-term and long-term side effects. Short-term effects. Euphoria. Sedation. Respiratory depression. Nausea and vomiting. Drowsiness. Confusion. Long-term effects. Tolerance and physical dependence. Respiratory complications. Cognitive impairment. Increased risk of infectious diseases, such as HIV and hepatitis C. Organ damage. Signs and symptoms of abuse upon assessment. Pinpoint pupils. Shallow or slowed breathing. Slurred speech. Drowsiness or unconsciousness. Confusion and cognitive impairment. Track marks, if injected. Potential for overdose or use as a suicide weapon. Fentanyl is frequently involved in accidental overdoses due to its high potency and rapid onset. Overdose signs include respiratory depression, blue lips, unconsciousness, and bradycardia. It has been used in suicide attempts, as a small amount can be fatal. Carfentanil, a fentanyl analog, is even more lethal and has been linked to mass overdoses. Comprehensive care plan for fentanyl use disorder. Pharmacological treatment. Medication-assisted treatment, or MAT. Buprenorphine naloxone, also known as Suboxone, is a partial opioid agonist that reduces cravings. Methadone is a full agonist that reduces withdrawal symptoms. Naltrexone, also known as Vivitrol, is an opioid antagonist that prevents euphoria. Naloxone, commonly known as Narcan, is used for overdose reversal. Cognitive behavioral therapy, or CBT, to address substance use triggers. Contingency management, which involves reward-based behavioral interventions. Support groups such as Narcotics Anonymous and Smart Recovery. Holistic approaches, including yoga, mindfulness, and meditation. Patient education and harm reduction. Risks of fentanyl-laced drugs. Importance of carrying naloxone. Harm reduction strategies, such as supervised consumption sites. Signs of overdose and when to seek help. Referral and follow-up. Substance use treatment programs. Mental health counseling. Primary care for medical follow-up. Community support groups. Follow-up. Regular follow-ups with substance use counselors. Monitoring for relapse and adjusting medication-assisted treatment regimens as needed. Encouraging family involvement for support. Fentanyl abuse has reached epidemic proportions, requiring a comprehensive, multifaceted approach involving prevention, treatment, and harm reduction strategies. Increased public awareness, accessibility to naloxone, and expansion of medication-assisted treatment are key to reducing fentanyl-related deaths.